Okay, this question that women ask is about vaginal dryness, being whether it's part of menopause, and if menopause can cause bladder problems like leakage or a lot of urine infections. Is this all because of menopause?
So the answer is yes, it can be. In the perimenopause and menopause, women can get dryness down below, and that can be just due to a lot of reasons, but mainly because of the drop in estrogen. So women can get dryness, it can feel a bit itchy, it can just feel a bit uncomfortable. And so sometimes using vaginal moisturizers or vaginal estrogen can help.
Okay, the next question is, can perimenopause or menopause cause any vaginal symptoms?
The answer is yes, they can. Some women may find that they get dryness down below, or they may feel things are a bit more irritated down below. They may find that if they're being intimate, so having sexual intercourse, it might be a bit more painful. You might also get some urinary symptoms, and these might look like you're suddenly going for a wee in the middle of the night, or you get urgency, which is when you need to go, you really need to go. So yes, you can certainly get symptoms.
So, if I have any of these symptoms, where do I go and what do I do?
So we know that women often don't tell us about these symptoms, and this might be because they feel a bit embarrassed or because we as the healthcare professionals haven't actually asked the question. So it's really important that you tell us about them. So some women find it really helpful to jot down symptoms on a menopause symptom tracker before the appointment, and that can just really help as an aid for you within the consultation if you do feel a bit embarrassed talking about it. But the healthcare professionals, we should really be asking you the questions as well.
And why is it important to talk about the symptoms down below, especially vaginal dryness and urine symptoms early, like in perimenopause, as opposed to leaving it for later?
Really good question. So we know that the longer women leave these symptoms for, the worse it gets. It's not going to spontaneously or suddenly get better. And then it becomes a lot harder to treat the more severe your symptoms are. So treating early is key.
And why is it important to treat these symptoms?
So, number one, for symptom relief. So, a lot of women who are really uncomfortable, really itchy, it can help with that. Number two, it can help with libido. So, vaginal tissue needs estrogen for arousal. So, if you're having any problems with the intimacy with your partner, vaginal estrogen will really help. Number three, it can also help prevent urinary tract infections or UTIs, which can be bothersome and people can get really ill with them. So it will help prevent that. And lastly, if you're having smears, you're still of an age where you're getting your smears, it can really help with making those smears feel a bit more comfortable. Yeah, so they're really good reasons to treat.
Brilliant. Are there any situations where a woman can't use them? And what are they? And if so, are there any other options?
Yeah, so firstly, vaginal estrogen is a very safe medication to use, and it is generally safe for everybody to use. However, there are exceptions. If you have active breast cancer and you are on treatment for this, so it might be a hormonal medication to treat the breast cancer, it might be that you need to talk this through in more detail with the doctor. It is still an option, but you'll have to have a good discussion about that. In that scenario, there's still other things that you could use. So you could use a vaginal moisturizer. The Yes products are very good, and you can buy these online. And you might also want to consider things like lubrication. And again, the Yes products are very good and offer a range for both of those things.
Okay, I've just been given this prescription. How do I go about using it?
Okay, so when you first get your prescription for vaginal estrogen, it might be a cream or it might be a pessary. If it is the cream, you will see a tube and you will see a syringe, and there'll be a little line on the syringe that you pull back the cream that will only allow to give you that amount of dosage of the drug. You then insert that slightly into the vagina, and people often do this at night time so it's less messy. In addition, You can use some of the cream around the rest of your genital area. So that would include your labia, over the clitoral hood, over where the wee comes out, your urethral orifice, and you can apply the cream on the outside as well. If you are using the pessary, again, there is a little applicator and that just sits inside the vagina. When you first get it, you will use this daily for 2 weeks. After that, you drop it back down to twice a week. However, if ever you're getting symptoms, you can increase that dose again and use it daily for a week or two and then drop back down to your usual dose.
Are there any other things that you want to cover in terms of how to treat these symptoms?
Yeah, so I think other really good top tips are: one, cotton underwear, loose fitting clothes. Number two, avoid soaps. Try and not use shower gels or bath additives because that can really irritate things down below. Some people use things like an emollient, which is a moisturizing cream, but actually you can use it down below. So Cetraban would be an example that you can just buy over the counter. And also the vaginal moisturizers help with the pH down there, which can change during the menopause. So the pH is basically just keeping things down there not too acidic, not too alkaline, and those products all really help.
So I noted that I had a chest infection last week, and when I was coughing, I was leaking. So this is what women come with usually. So what to do about it, and is there anything that can be done about it?
Yeah, so I think this is something that we see quite a lot. And I think some women think that leaking wee or leaking urine is normal and it's just accepted that, oh, I've had 3 kids and yeah, I'm going to be leaking urine. So what I would say is it's not, it shouldn't just be accepted that that is the norm. And if this is a problem for you, please do come and chat to us. What we will do is we will take a full history, which means asking lots of questions about when you're leaking. Is it just coming away with no warning, or is it when you're coughing or sneezing? We might look at how many children you've had in the past, and if they've been big babies or if they've been vaginal deliveries or C-sections. All of those things are really important. And then we might examine you down below, and that's to see if there are any vaginal prolapses, for example, which can cause some of the urinary leakage. There are loads of options that we can do to help with this. One might be using vaginal estrogen, which helps support those tissues down below and can help with urinary problems. It might be we refer you to our pelvic physio for some pelvic floor exercises. And it might be that we can also refer you to the incontinence team who can further assess, and they may do a bladder scan and things like that. But I think the key message is please don't just sit at home with these symptoms and come forward and tell us about them, because there's always things we can do to help.